In this Chapter 2 video, Essentials of Community Health Nursing Practice will be reviewed. Just as in your clinical practice, community health nurses must be familiar with the scope and standards of practice in the community. These nurses promote and protect the health of populations using knowledge from nursing, social, and public health sciences. The goals of promoting health and preventing disease and disability for all people through the creation of conditions in which people can be healthy guide both public and private organizational nursing practice. The student learning outcomes continue from the previous video, so you should consider how the essentials of community nursing practice can be used to deliver nursing care to communities, and how evolving social, cultural, and healthcare delivery trends in the development of healthcare programs are utilized throughout community nursing practice. What is community health nursing? This term is used to denote the practice of nursing by professional nurses, or nurses who have obtained their baccalaureate degree in nursing. These nurses have been educated in the processes of population-based nursing and whose principal client is the community. Community nurses practice in a variety of community settings, including schools, workplaces, shelters, health departments, and other sites. Partnering with schools, workplaces, shelters, and religious sites will be reviewed in the upcoming weeks. In order to understand the context of community nursing, a reflection on the past history of health in the community is needed. In the early part of the 19th century, several nurses recognized how poverty, gender, and ethnic inequalities affected health. Unhealthy workplaces and environments also were noticed as they affected the health of the population. Rapid industrialization, large concentrations of people moving into unsanitary environmental conditions, poor housing, poverty, the misuse of child labor, infectious diseases, and short life expectancies were the stimulus for these nurses to advocate for environmental sanitation, reformation of social and health policies, and the establishment of nursing schools that included education in how to care for communities. Hospitals were not what they are today and were reserved for the acutely ill with limited surgical interventions. Much of the health care was provided to individuals in the home, and public health nurses worked to improve the health of their own local communities. Healthcare has evolved significantly since the 19th century, and thanks to the efforts of early public health nurses and the discovery of antibiotics, morbidity or disease and mortality or death have declined significantly. The Centers for Disease Control note that public health has added 25 years to the life expectancy of people in the United States. The CDC has also identified the greatest 10 public health achievements in the 20th century that have contributed to the increased life expectancy. These include immunizations, improvements in motor vehicle safety, workplace safety, control of infectious diseases, a decline in deaths from heart disease and stroke, safer and healthier foods, healthier mothers and babies, family planning, fluoridation of drinking water, and recognition of tobacco as a health hazard. We don't really think of these health issues as concerns any longer because of the efforts of public health. Advocates for issues such as healthy workplaces, absence of secondhand smoke in restaurants and bars, and infant and child car seats have advanced the health of communities. In recent years, however, officials who develop health regulations and policies have become more interested in clinical hospital care, where the focus is on acute treatment of illness and high-tech care and medicine. Because of this focus on acute care, there has been less attention to family and community-based care. This is where the concerns related to the high cost of health care are found. Because past debates about how healthcare should be focused, which have been primarily in the acute care setting, The costs of healthcare have been increasing. Even though the mechanisms to deliver and pay for acute illness care are driving current healthcare system changes, more emphasis should concentrate on what can be done to make the population healthier rather than to debate how to best pay for acute care. Research has suggested that it takes excellent health promotion to minimize the cost of acute care. This seems logical because if you take care of your health and act to prevent disease individually, the need for acute care is limited to just injury care and disease care that are caused by unmodifiable conditions, such as genetics. Health promotion results in wellness, reducing or eradicating illness. But that has not been our focus in healthcare. The current model is a medical model which seeks to treat diseases that have developed largely due to this lack of health promotion. Think about your clinical patients who present to the hospital with heart and respiratory diseases from poor diets and poor social habits, such as drinking alcohol or smoking cigarettes. Even though these individuals have not practiced healthy living, they still expect that the medical model of health will provide them with medications, treatments, and risky surgeries to remedy their disease processes. Community health in the coming decades must focus on minimizing threats to health, promoting wellness, and finally focus on disease management. To improve the health of communities, community health nurses need to focus on these 10 essential public health services. Table 2.1 at page 22 of the textbook outlines these services with nursing actions that can be used to promote these services. Monitoring health statuses to identify the community health problems should include nursing actions to include the participation in community assessment and identifying potential environmental hazards. This is an activity that you will be performing in your clinical practicum as you develop your windshield survey and community assessment. Diagnose and investigate health problems and hazards in the community. Nurses can understand and identify determinants of health and disease. This is again something you will be doing as you develop your community assessment in the clinical course. Informing, educating, and empowering people about health issues. Nurses can develop and implement community-based health education. This might be an intervention you propose from the evaluation of your windshield survey data. Mobilize community partnerships to identify and solve health problems. Nurses can explain the significance of health issues to the public and participate in developing plans of actions. Will you be able to identify partners in your own community assessment? Develop policies and plans that support individual and community health efforts. Nurses can advocate for the development of programs and services to meet the needs of high-risk populations and other members of the community. Perhaps a policy is needed in your own community that addresses a community health issue you have identified in your windshield survey. Enforcing laws and regulations that protect health and ensure safety. Nurses can advocate for the regulation and safe care and treatment for dependent populations, such as children and the elderly. Do these populations have special needs in your own community? Linking people to needed personal health services and ensuring the provision of health care when otherwise unavailable. Nurses can help to establish programs and services to meet the needs of special populations. Part of your efforts in the clinical course will be to identify available resources in your community that can promote health in the population. Ensuring a competent public health and personal health care workforce. Nurses in all practice settings, including community health, need to participate in continuing education and preparation to ensure competence. Evaluating the effectiveness, accessibility, and quality of personal and population-based health services. Nurses need to identify unserved and underserved populations of the community. You might identify these populations during your own community assessment. And finally, research new insights and innovative solutions to health problems. Nurses have the expertise and knowledge to participate in early identification of factors that can be detrimental to the community's health. You can probably begin to look around at your own community to identify areas of interest to research in your own community's health. Changes are occurring rapidly in the healthcare system. These changes are impacted by healthcare reform, changing demographics, globalization, poverty, and growing health disparities, as well as violence. In healthcare reform, 5 factors impact the need to change and how healthcare is paid for. There is a high rate of uninsured Americans under the age of 65. This is an unsustainable healthcare spending that represents almost 18% of the gross domestic product. There is a lack of emphasis on prevention, too many poor health outcomes, and increasing health disparities. Note that 7 of 10 deaths in the United States are related to preventable diseases, and 75% of our healthcare dollars are spent on treating these diseases. In your clinical practice, do you sometimes feel that your patients are passing through a revolving door that causes them to return to the acute care setting because of their ongoing health needs? The demographics of our country is changing as well. The population continues to increase, and changes in immigration laws are changing the ethnic makeup of the country. Studies have predicted that by 2040, 1 out of every 5 Americans will be 65 years or older. This means that the focus of medical care from the acute to chronic illness will affect the quality of life, and health promotion strategies are needed if this population is to remain healthy. Chronic illness severely impairs the quality of life, yet our acute care system is designed to affect a person's quantity of life. Globalization was already discussed in Chapter 1, and the changes that are occurring due to globalization will be seen as communication technologies enhance how health is promoted internationally. Remember, though, there is still the issue of the haves versus the have-nots. How is technology used in your community to promote health? Do all members of your community have access to such technology? People's health and well-being suffer the most when they are unable to secure employment and can no longer access the safety nets and supportive services. Think about where you work. Your work provides you much more than a paycheck. It most likely provides you a support system of coworkers who notice your health and activities. It provides you a regular schedule of activities. And it also provides you access to health care through an insurance program. What happens when those aspects of your job are lost? Losing this type of support system means loss of social interventions as well as a financial loss. Many individuals in the community must make decisions about what to pay for when they lose their income or have reduced income. Which are priorities for you? Health care, or electricity, or maybe even housing? Finally, violence in the community is becoming a growing concern. We hear daily about violence in areas and how it affects communities. The weakening of relationships, such as in families, between generations, and in communities, can lead to social disintegration, which causes the health of the community to decline and injuries and violence to increase. These essentials of community nursing practice require an understanding of the evolving social, cultural, and healthcare delivery trends to deliver and develop healthcare programs. How can nurses develop effective community practice with regard to these issues? ANA standards of nursing practice are also important as you provide care to communities, and the nursing practices you currently use in your own clinical practice must be extended and adapted to working with communities and individuals outside the hospital walls.